Hi guys, this is Squishy Bee. I just wanted to touch base today briefly to just apologize for not having been able to do some videos for a while. I'm still here. I just had been admitted to the hospital for a while, and I am back home now, and I should be back to working on videos, I would say, Thursday, because that's when my husband goes back to work. But I did want to just kind of share with you a little bit about my hospital experience, being that I'm in New York, and people might just find it interesting to know what's going on. So when I first pulled up at the hospital, it was, of course, it was that tent outside, and you couldn't, well, first, I'm sorry, let me back up for a second. You couldn't just go to emergency. I hadn't actually planned on going to emergency. I had just called my doctor's office to see if I could come in there, but they're not actually seeing people here in the offices. And they wanted me to go to urgent care, which I did. And when I got there, you couldn't just walk in there either. There was a sign on the door saying that you had to wait in your car and call this number. Then once I did, they were like, yeah, come right in. So I went in, and they were all wearing the shields, like that looked like a motorcycle helmet kind of thing, and they had masks on underneath that, and they had gloves on, and I'm trying to remember if they had the gowns on. I think they had the gowns on over top of their clothes also. And they took my information and brought me back. There was hardly anyone there at all. But people just were like all over me like crazy. I couldn't believe how many people immediately came over. Mainly just because I was short of breath, and I didn't have, as you can hear, my voice is messed up, mainly because my throat muscles are not working properly, and my diaphragm muscles aren't working properly. So I knew, my regular doctor knew that it was most likely my normal health issues, as I have myasthenia gravis, and they thought I might, been having a myasthenia gravis crisis, and so they took me back and, checked me out. The lady was really nice. This wasn't my normal office, so I wasn't sure what to expect, but the doctor there was really nice. And, of course, they saw my blood pressure and, wigged out. And I was like, no, this is just normal for me. So, I had to convince her not to send me by ambulance. And, after, much convincing, and her looking through my records and realizing that, I'm stuck like this, she agreed to let my husband drive me. But she had called the hospital. She had to call, and they said, yes, that I needed to go into emergency. But they didn't test me for the COVID because I didn't have a fever. And I would imagine because I had these other underlying health conditions that cause these things. And plus, obviously, they could hear my voice. So I know that that's not a COVID thing. That's a myasthenia gravis thing. And so we drove to the hospital, and then when we got there again, there was that tent outside. And the people in that tent came up to the car and were like, who are you? What do you want? And so we explained, and they had my name on a list that, they knew I was coming. And so then they allowed me in, but they wouldn't even let my husband park there. And we live an hour and a half away from the hospital. We live really far out in the middle of nowhere. So I didn't know where to send him. So we explained that, and we convinced them to let him go park in this one area, which he just sat there because they, for hours. because he had no idea what they were going to do. And so I went into emergency, and there was nobody, not a single person, in the waiting room. And they took me back within 5 minutes, I'd say. And when I got back into emergency, then back there were a lot of people. I was kind of surprised, but it was quite full. It wasn't like it usually is, because normally this hospital is very like they're overwhelmed with patients, to the point, like last time I was at this hospital, all of the patients were, the rooms were so full that the patients were lined up on stretchers just around the center circle of where the doctors and nurses are in the center part, and then around that, people were just lined up in a circle. No privacy, nothing. And they would just come, and the doctors would talk to you and examine you and everything right there out in the open in front of everyone. So it wasn't like that this time. This time I was in a room by myself, but I could hear that there were a lot of other people, a lot of coughing people, and that you could hear the nurses and the technicians talking just outside, our little cubicle, and they were scared. They were all really scared. They were scared of me when I went in there, because I was short of breath, and I could hear them discussing that outside of my door. And they, almost like even before they brought me back, they were talking with each other in like at the reception area there. The nurses came out, and as soon as they heard that I was short of breath, they were kind of almost arguing who was going to take me. So that made me feel real comforted. So, but they were all geared up as well. They had the shields that looked like, the motorcycle helmets, and they had masks on underneath that, and they had gloves, and so they do appear to have the equipment that they need, right, as of the time I was there anyway this week. So that was good. I was glad to see that. So then I was there for hours waiting for them to do tests and stuff, and then they came back and said they were going to admit me, and so they moved me up to the Heart Institute, and I was admitted there, and they continued to do tests and stuff there. And again, when I got up there, you could keep hearing them talking. They don't seem to hide much or care that the patients can hear what they're saying. And they were really concerned that they were going to have to come into my room, and knowing that I was short of breath. And they still did not test me for COVID, although they did do a chest x-ray, and I would imagine if I had the COVID, they would have seen it on the chest x-ray. But they didn't do the swab thing. They just, because I think for one, I didn't have a fever. I think that's one of the deciding factors. If you don't have a fever, they don't even seem to test you. But I would imagine if they had seen something on my lungs that looked like COVID, then they probably would have tested me at that point. And so anyways, I ended up where I was so nervous, honestly, about being there, because the people were going in and out of other patients' rooms that had COVID, and there was a lot of people with COVID in this hospital. So with my immune system, I really didn't, and in fact, the doctor that admitted me was like, I'm really scared about admitting you, because of your immune system, it's really dangerous and not ideal for you to be admitted, but it was too dangerous for me to go home, because I personally could have ended up on a vent anyway because of the myasthenia gravis. A lot of times we end up on a vent for that. But I was also having other issues. I have MS, and I have have kidney disease, and my kidneys are working at like half, like 50% at this point. So I'm accumulating a lot of fluid and stuff, and these things can also make it hard to breathe. And so I have so many complex things for them to have to try to figure out. And I had also just had strokes this year, so they were concerned that my throat could be affected from the additional strokes, and also they thought maybe it could be from the MS. So it's really complex and hard to figure out. But anyway, I kind of determined after a certain number of tests and after a certain amount of time that I was like, I'm sorry, but I gotta peace out. I can't stay here knowing that there's so much COVID in this hospital, and they had ruled out a few of the most important things I wanted to be checked, but they didn't want me to leave. The lady that came in on the last day, she stood across the room because she's like, I'm staying over here not because I'm afraid of you, but because I've been going all over this hospital and caring for COVID patients. And so she stood from, like maybe, I guess it would be 6 feet away, not too much more than that. And she was like, you really shouldn't be leaving, and if you leave, you're going to have to sign against medical advice paperwork. And I was like, that's fine, I'll do that, because I just don't feel safe staying here for this long. They were also just really overwhelmed and unable to really get in there to do, like, for one thing, they weren't giving me any of my medications that I was afraid I was going to have bigger problems being there and unable to stay on the proper medication system that I had set up. And they were trying things that I didn't think they should be trying, because for one, my kidney doctor that normally he oversees my blood pressure treatment, he's like, don't let people in the hospital give you new blood pressure medications, because the last time they did that, my blood pressure tanked to like 60/40, and I went unconscious, and they had a really hard time getting it back up, because I have that autonomic dysfunction thing in my brain where that controls your breathing and your blood pressure and stuff. And so it's really dangerous to change medications, because my brain is just retarded. I don't know how else to describe it. It just does not know how to regulate your blood pressure. So if you try certain medications, it could be, my blood pressure could be like 220/130, which is common for me, and they'll give me something to bring that down, and it'll just go overboard and drop way too low, even with just like the tiniest dose of something. If it's something it doesn't recognize, it's like goes crazy the opposite direction. Doesn't really make sense, but that's just it's like a problem with the brainstem. So anyway, so they tried giving me these medications, didn't discuss it with me at all, or ask me or tell me what it was. And the nurse was like, here, I'm just giving you this, and you need to take it. And I'm like, what is this? And she was like, it's a blood pressure medication. And I said, well, I really can't, I'm not supposed to take anything that my, nephrologist hasn't approved, because this is what's happened in the past. And she was like, oh no, I'm sure that won't happen, and if it does, we can see you on the monitor. Which they weren't watching the monitor at all, because the alarms were going off like constantly, because my heart rate was going through anytime I would get up and move or do anything, my blood pressure would go up, and my heart rate would jack through the roof. And then they weren't giving me my tachycardia medications that I'm normally supposed to be taking twice a day. The whole time I was there, they didn't give it to me. So you can't just go days without taking that. And so I just felt it wasn't a safe environment for me there. So I signed myself out against medical advice and just left. And so I just wanted to mention though that everybody there had a mask on. Everywhere I went, even just walking through the like the lobbies and stuff, I saw people that were just like janitors and stuff like that. They were fully geared. So it seems they do have stuff. It just bothers me that people in other positions outside of the hospital, like home health aides and people working in group homes, they don't have any masks or anything. And even just like bus drivers or grocery store workers and things like that, I feel like they should be provided proper masks to keep from giving people this stuff. And I did want to just also mention something else that happened that was crazy. Just before I had gone into the hospital with all of this, my husband had gone into work. He works at Wal-Mart. And when he walked in the door, well, at first they had just started doing the thermometer thing at the door, so that they checked your temperature when you first got in, and if you had any kind of fever, whether you were a customer or an employee, they won't let you in. So he passed, so they let him in. And when he first got in there, his old boss came up to him and he's like, "Hey, if I were you, I would turn around and walk back out." And he was like, "Why? What's going on?" And he said, "Well, one, your wife has crap immunity, so you were already putting yourself at risk and putting her at risk by working, but a whole bunch of people are sick, really sick, with high fevers." And this one couple that worked there, he said, had tested positive for the COVID, and there was another guy that they were waiting to find out if he had it. So my husband took a week off just to, until things calmed down. They had some answers on what was going on. And then he called his current boss and asked what was happening. And he was like, "Oh, I'm so glad that you called, because the couple that he had told them tested positive had not actually tested positive. That I got the impression that they had lied about it, but I don't really know who to believe, except that they were deathly ill, really high fever, and they were afraid to come to work and give it to other people. Now, I'm at a point where I just don't trust anybody. I don't know if they lied about it so that they, could get out of going to work and get paid for it, or if Walmart is just changing their story, because the guy said as soon as they had a meeting and told people this, pretty much everybody left. So they had nobody to work. And then, they said other people had to come back. They had just had a cold or whatever, but they had a really high fever, and you're going to tell me they just had a cold? Something isn't right there. And so many people, and they were all working close together. So it just makes me really concerned that maybe people have this and they're still going to work. So I don't know. And then I talked to someone else who has a good friend that works at Amazon in the actual distribution center. And they said, "Hey, make sure you tell your family not to order things from Amazon, because there's some really crazy crap going on there. They're doing very irresponsible things, that lots and lots of people have COVID and are still coming to work at Amazon. And they are also not wearing any protective stuff when they were working. They weren't providing anything. So they were working without any gloves even, and they had the virus, and they were still coming to work with it. And so I don't know what to think, except, man, you just gotta at least wipe things down. Let things sit for the amount of time that it takes for the virus to die on surfaces. And if it's any kind of metals, let it sit even longer, because it takes longer on metals to die. So just wherever you get it, you don't know who's got it and who doesn't, so play it safe and just, treat everything like it's been touched by someone with COVID. That's all I can say. And with respect to like food, if it's something that you're going to cook and you can cook the virus out of it, that's one thing. But I get very nervous about things that don't get cooked, like fruit and lettuce and stuff like that. And I watched people saying on like normal news, I don't remember which channel it was, they were saying, oh, you could just rinse your lettuce and stuff with water and that's good enough. That just doesn't sound rational to me when you're saying that if you have the wrong kind of hand sanitizer that doesn't have enough of a percentage of alcohol in it, it won't kill the virus. So why would plain water do it? That just isn't logical to me. So that's another thing. I just go with what sounds rational. I mean, there's just so much stuff that seems like common sense to me. And I don't trust the people that are running things and that are giving advice on this. How can we possibly trust people? Is like this, for example, in New York, for them to be giving us advice after, at the very beginning, they told people to go ahead, go on the subway, go to work as normal. It's no big deal. And she actually used the terms, especially make sure you go to the Chinese New Year parade in Chinatown. And that is obviously how come it spread so much in New York. Give me a break. They were encouraging people to go out in crowds and go on subways in crowds and things as normal when they knew that this thing was terrible and that it was going to spread. So it's like they wanted this thing to happen. And I have a few ideas of why I think that would be, but I'm not supposed to be talking this long. So I'm going to have to cut this short for now, and I will be back on in a couple of days, and when I have the chance to rest a little bit more after I got home, and hopefully I'll have more of a voice by then. Hopefully you can even hear this. So I will be back again to go over some things that are really going to blow your mind, some stuff that I found that I have not heard anybody else talking about that I really feel people need to know. And it's to do with some like the symbolism that I found. Remember how I said that, the people that are running things, the Satanists, that they use these secret codes to talk to each other. Well, I stumbled on something that clearly represents COVID that's been in stuff for years, that once I saw it, I couldn't unsee it, and I found it in everything. So much stuff. So I'm going to go over that and start working on that Thursday when my husband goes back to work. And I'll try to get done as quick as I can. So until then, guys, stay safe. God bless you. And I'll be seeing you. Bye-bye.